Nasal polyps are soft, painless growths that form on the inside lining of your nose or sinuses. They look like tiny, teardrop-shaped balloons, and they are usually the result of long-term inflammation. This inflammation can be caused by allergies, asthma, chronic sinus infections, or sensitivity to things like dust, pollution, or certain chemicals. Over time, the irritated lining swells and forms these polyps. They often grow in both nostrils and can vary in size. Small polyps might not cause any symptoms, but larger ones can block the nasal passages. That leads to stuffiness, difficulty breathing through the nose, reduced sense of smell, facial pressure, and even snoring or poor sleep. One common question is, are they dangerous? The good news is no, they are not cancerous, but they can seriously affect quality of life, especially if they keep coming back. Doctors usually start with medications like steroid nasal sprays or tablets to shrink the polyps, but if those don't help, or the polyps are too big, then surgery is often the next step. When nasal polyps don't shrink with medication, surgery is often the next step, and the microdebrider is the tool most commonly used for this. A microdebrider is a precise surgical instrument with a small rotating blade and built-in suction. It works like a tiny electric shaver inside the nose. As it gently shaves off the polyp tissue, it also suctions the debris at the same time. This keeps the surgical field clear and reduces bleeding, making the procedure safer and more efficient. The entire surgery is done through the nostrils using an endoscope, so there are no cuts on the outside and no visible scars. The microdebrider allows the surgeon to work with great accuracy, especially around delicate areas like the orbit and the skull base. Most patients go home the same day and notice a big improvement in nasal breathing and sense of smell. After surgery, we usually recommend regular saline rinses and steroid sprays to help keep the nose clear and reduce the risk of the polyps coming back.